Welcome to the deep dive. Imagine this. You wake up one morning and your usually perky, happy dog's ear is suddenly swollen, drooping, maybe warm to the touch. It's pretty alarming, right? You immediately wonder, what on earth is that? Well, that sudden kind of squishy lump, that's the reality for countless pet parents dealing with what veterinarians call an aural hematoma. Today, we're not just defining it. We're going on a journey to really understand why it happens, how you spot it early, and, what genuinely works to fix it. So you're ready for anything your furry friend throws your way? Our mission, like always, is to sift through the sources, pull out those crucial nuggets of knowledge, and give you clear, actionable insights.
And that mission is incredibly important here.
Yeah.
Because while a hematoma might seem like just a simple swelling, its implications can be pretty significant for your dog's comfort and their long-term ear health.
Right.
Our source material really highlights that a lack of prompt, informed attention can lead to, sustained discomfort and even permanent changes to the ear's structure.
Wow.
So this deep dive is truly about equipping you, the listener, to be the best advocate for your dog's well-being.
That's a powerful way to frame it. Okay, so let's start with the absolute basics then, because when you first see it, it can be quite confronting. What exactly is an ear hematoma in terms we can all easily grasp?
Okay, well, at its core, a canine ear hematoma, you'll hear vets call it an aural or auricular hematoma. It's essentially a localized collection of blood. It pulls up within your dog's ear flap. The part we typically call the pinna.
Well, floppy bit.
Or the pointy bit.
Depending on the dog. Exactly. Think of it like a very large internal blood blister. But it's not just on the surface. That's key. What's happening underneath is that tiny blood vessels nestled between the skin and the cartilage of the ear, they've ruptured. And when they break, blood leaks out and accumulates in that space. That creates this distinct swollen, often spongy lump or pocket. Depending on how fresh it is, it might feel soft and fluid-filled, or maybe taut and springy, or even quite firm as it starts to organize. So it's not just a surface bruise then. It's actually a structural thing happening within the ear itself. That helps visualize it.
Precisely. And while most of the time you'll see this affecting just one ear, our sources do point out that it's possible. So, less common for both ears to be involved.
Good tip. Always check both ears.
Yeah, definitely worth a look.
Now that brings us to the really interesting part. Why? Why do these things happen in the first place? It's not like dogs are just spontaneously developing these swellings. What are the core reasons behind these often alarming lumps?
Right. And what's truly fascinating here, and maybe a bit counterintuitive for many owners, is that most ear hematomas in dogs aren't actually caused by a direct, single, hard impact.
Really? I would have assumed a bump or something.
Well, a sharp blow can cause one, sure. But the vast majority, and we're talking over 80% in some studies mentioned in our materials, are actually the cumulative effect of repeated indirect trauma.
Indirect trauma.
Meaning the primary driver is almost always vigorous, relentless head shaking, or persistent scratching at the ear.
So it's not necessarily a forgotten tumble in the yard, but maybe hundreds of smaller, constant impacts from their own head shaking.
Exactly right. That's a crucial distinction. It implies it's often a symptom of another problem bubbling under the surface, not just a standalone injury.
Okay, that makes sense. So what causes all that shaking and scratching then?
Well, we find a few very common culprits. Ear infections are a huge one.
Yeah, I've dealt with those before.
Right, whether they're bacterial or yeast infections, they cause intense irritation, itching, and inflammation deep down in the ear canal. This discomfort then leads to that vigorous head shaking and scratching, which over time literally batters the delicate blood vessels in the ear flap until they rupture.
So if your dog is constantly scratching or shaking their head, that's a huge red flag. Like even before a hematoma ever shows up, you're essentially seeing the early warning signs of potential self-inflicted damage.
Absolutely. Beyond infections, allergies are another major factor. Dogs can suffer from environmental allergies, pollen, dust mites, you name it, or even food allergies.
Oh yeah. Allergies seem to cause all sorts of issues.
They really can. And these allergies often cause chronic inflammation and intense itchiness in their ears, leading to that persistent scratching and head shaking. It's a vicious cycle that can unfortunately end up causing a hematoma. Our sources also specifically highlight how breeds with those long, heavy ear flaps, like, Basset Hounds or Cocker Spaniels, can be particularly prone.
Oh, that makes sense. More weight flapping around.
Exactly. Their ears experience increased impact during shaking, essentially flapping against their own heads, making them more susceptible to this kind of trauma.
More surface area, more flopping, more potential for vessel damage. Got it. Are there other common irritants?
Yes. Parasites, like ear mites or even ticks, are significant sources of intense ear itching and irritation.
Ugh, mites. Nasty little things.
They really are. And sometimes it's something as simple as a foreign body, maybe a stubborn grass seed or a tiny burr that gets lodged deep in the ear canal. The dog's attempt to get it out through scratching or shaking can directly lead to a hematoma. And while less common, we should mention direct injuries too, an accidental bump, a bite wound from another animal, even rough play.
Okay. And are there any other, maybe more systemic reasons, things that might make a dog more vulnerable?
There can be, though they're less frequent. Certain underlying medical conditions can predispose a dog. For instance, if a dog has an underlying blood clotting disorder, they might be more prone to bleeding and hematoma formation, even with, milder trauma.
Okay.
Also, immune-mediated diseases or chronic skin disorders can cause generalized inflammation, making the ear blood vessels more fragile and susceptible to rupture.
So what does this all mean for you as a dog owner listening right now? It sounds like identifying and treating that root cause. It isn't just about fixing the immediate swelling, is it? It's about preventing it from just coming back again and again, solving the whole puzzle.
That's the critical takeaway from all our sources. Vets emphasize that proper diagnosis and diligent treatment of these underlying causes, infection, allergies, parasites, whatever it is, are absolutely essential to prevent recurrence. Otherwise, you're just treating the symptom, and the problem will almost certainly return, potentially even worse next time.
Okay, let's unpack this further then. Once you suspect something is up, how would someone even know for sure their dog has an ear hematoma? And what happens when they take their dog to the vet? What are the telltale signs we should be looking for at home?
The symptoms are often quite distinctive, which is actually helpful for owners. You'll primarily notice a visible, often pretty alarming, swelling on all or part of the ear flap itself.
The lump, basically.
The lump, exactly. And this swelling can feel, soft and squishy, almost like a water balloon, or it might be quite firm and taut. It really depends on how much blood is accumulated and how long it's been there.
So if one ear looks or feels noticeably different from the other, that's a definite alert.
Precisely. Another common sign is that the affected ear may droop or hang lower than usual, even if it's normally a perky ear.
Okay.
You might also notice redness and warmth of the ear flap when you touch it. And critically, your dog will almost certainly show clear signs of pain or discomfort.
How would they show that?
Well, they might resist having the ear touched, maybe yelp or pull away. They might paw at the ear constantly, or continue that vigorous head shaking that likely caused the issue in the first place. You should also be vigilant for signs of the underlying cause, like persistent itching, an unusual odor.
That yeasty smell or something worse.
Exactly, that distinct yeasty smell, or a foul bacterial odor, or any discharge from the ear canal, especially if an infection is present.
So it's not just the visible lump, it's the dog's behavior and other clues, like smell, that give us the full picture.
Right.
Once we've noticed these signs and made it to the vet, how do they actually confirm the diagnosis?
The diagnostic process is usually quite straightforward, actually. A thorough physical examination by the veterinarian is often enough for an initial presumptive diagnosis. That swollen, fluid-filled lump on the ear flap is typically very distinctive.
Pretty hard to miss, I imagine.
Yeah, pretty much. To confirm it definitively, though, a vet will perform a needle aspiration. This just involves inserting a thin needle into the swelling to draw out some fluid.
Okay.
If blood or blood-tinged fluid comes out, that confirms the presence of a hematoma. It's a quick, minimally invasive step.
And do they just stop there, or do they immediately shift focus to finding that underlying cause we keep talking about?
Oh, they absolutely pivot to finding the underlying cause, because without addressing that, like we said, the hematoma is almost guaranteed to return.
Right. Makes sense.
So, using an otoscope, that's a special instrument with a light and magnifying lens, the veterinarian will carefully examine the entire ear canal. They're looking for potential issues like infections, parasites like mites, or any foreign bodies stuck in there.
Like a little detective scope for the ear.
Pretty much. They might also take a tiny ear swab, almost like a cotton bud, to look at under a microscope. This process, called cytology, lets them zoom right in. They can literally see if it's bacteria, yeast, or those sneaky mites causing the trouble.
Wow, okay.
And if allergies are suspected, further allergy testing might also be recommended down the line. The goal is always to treat both the hematoma and its root cause simultaneously.
So we've gone from recognizing the subtle signs to confirming the diagnosis. Now, with a clear picture of what's going on, the next critical step for any owner is understanding. What are the actual strategies vets use to fix an ear hematoma? Are there different approaches, or is it sort of a one-size-fits-all solution?
That's a great question, and it really highlights that what looks like a simple swelling can have, well, different treatment paths. What's fascinating here is how these different approaches are chosen. It often depends on the specifics of the hematoma, like its size, how long it's been there, and the individual dog. But treatment primarily focuses on three main aspects. First, addressing that underlying cause we just hammered home.
Check. Crucial step.
Second, actually draining and managing the hematoma itself. And third, providing comprehensive supportive care during recovery.
And you've already emphasized that tackling the underlying cause is paramount for preventing recurrence, right? That's the first line of defense, happening alongside everything else.
Precisely. That's the foundational step, and often happens concurrently with treating the hematoma. Vets will treat any identified ear infections, allergies, or parasites with appropriate medications. Antibiotics for bacteria, antifungals for yeast, antiparasitics for mites alongside thorough ear cleaning. This is crucial to reduce the itching and irritation that prompted the self-trauma in the first place. Stop the cycle of re-injury.
Got it. Now, about dealing with the hematoma itself, the actual lump, what are the options there and what are the trade-offs?
Okay, so there are two primary approaches for directly managing the hematoma. The first is needle aspiration. This involves using a needle and syringe to repeatedly drain the fluid from the ear flap. It's the least invasive option.
Less invasive sounds good.
It does. And it offers faster initial healing, often within a week or less, with no surgical incision or suture care needed.
That sounds pretty appealing on the surface, less invasive, quicker initial healing, but I'm sensing a but coming?
There absolutely is a big but.
Yeah.
Our sources unequivocally highlight that needle aspiration has a very high recurrence rate.
How high are we talking?
Often over 50%, sometimes even reported in high as 70 or 80%.
Wow, that's really high.
It is. This means it frequently requires multiple trips back to the vet for repeat procedures, which can prolong the overall treatment course and definitely increases stress for both the dog and the owner. It's generally considered best suited for very small, very new hematomas, developed within the last 24 to 48 hours.
Okay.
While combining it with corticosteroid injections into the ear can help reduce inflammation and maybe lower recurrence slightly, It still carries a significantly higher recurrence risk compared to the other main option.
So it might seem easier up front, but it often leads to a longer, more frustrating journey potentially. What's the more definitive second option then?
The second approach, and often considered the gold standard for most ear hematomas, is surgical repair.
Gold standard. Sounds serious.
It's more involved, definitely, but typically yields far superior long-term results. It involves the veterinarian making a surgical incision.
Okay, actually cutting into the ear flap.
Yes. Then thoroughly draining all the accumulated blood, flushing the pocket clean to remove any clots, and then, this is really important, suturing the ear flap. These sutures aren't just for closing the incision. They are strategically placed, often in a mattress-like pattern, running right through the ear flap from one side to the other.
Like quilting it.
That's a great way to think about it. Their job is to hold the skin and cartilage layers firmly together, effectively eliminating that dead space where blood could just pool up again. It helps the ear heal flat, like you said, quilting it down so there's no room for fluid to reaccumulate.
Okay, that sounds much more comprehensive. A preventative solution built in. What are the advantages there, and what does recovery look like?
The advantages are pretty significant. Surgery boasts a very high success rate. Our sources report anywhere from 91% good to excellent outcomes.
That's much better than the aspiration odds.
Much better. And critically, it has a much lower recurrence rate, typically ranging from 0% to maybe 25%.
Yeah.
Surgical techniques are also specifically designed to minimize the risk of scarring, or that permanent cauliflower ear deformity we mentioned, which can happen if a hematoma is left untreated or poorly managed.
Right, the lumpy ear look.
Exactly. As for recovery, it usually involves a healing period of about 1 to 2 weeks for the incision itself. The sutures typically stay in for about 10 to 14 days. Full resolution of any residual swelling or thickening might take several weeks even after the sutures come out, but the main healing is relatively quick.
So it's a bit more involved up front, more recovery initially, but a much better long-term prognosis for the ear's appearance, the dog's comfort, and the owner's peace of mind probably.
Exactly. Then, regardless of the draining method chosen, there's the crucial aspect of supportive care and recovery. This often includes compression wraps or bandages applied to the ear. They help hold everything in place and reduce fluid trying to build up again. Think of them like a gentle, supportive hug for the ear.
Makes sense.
Medications are also common. Anti-inflammatories, often steroids, which don't just reduce swelling but crucially bring down the discomfort and itchiness. Antibiotics are frequently prescribed, especially if surgery was involved or if an infection was the root cause. And then there's the famous or infamous Elizabethan collar.
Ah, the dreaded e-collar, the cone of shame. I've seen dogs become surprisingly adept at knocking things over with those.
Haven't we all? But they're absolutely vital here. It's almost all it was necessary to prevent the dog from scratching, shading their head violently, or rubbing the ear against furniture.
Which could undo everything.
Exactly. It could easily re-injure the delicate healing tissue and undo all that hard work, whether it was aspiration or surgery. It's an inconvenience, yes, for both the dog and the owner trying to navigate doorways, but absolutely crucial for a successful, uneventful recovery.
Okay, so putting it all together then.
Yeah, if we connect all this to the bigger picture, it's clear that with appropriate and prompt professional veterinary treatment, most dogs recover very well from ear hematomas. The prognosis is generally good, and their ears typically return to a normal or near normal appearance and function.
That's really reassuring to hear, but what happens if an owner decides to just leave it? Maybe they can't afford treatment right away, or they hope it'll just go away on its own. What are the consequences of not treating it?
That's a really critical point to address. If an ear hematoma is left untreated, it will eventually organize and scar. The blood within the ear flap will clot and then gradually, slowly, be reabsorbed by the body over weeks or months. However, as it heals naturally without intervention, the ear cartilage often contracts and distorts significantly. This leads to a permanent, irreversible deformity commonly known as cauliflower ear.
Cauliflower ear? Doesn't sound pleasant.
No, and it isn't just an aesthetic issue, though the ear will look thickened, often lumpy, and might not stand or lay normally anymore. It can actually change the shape of the ear canal, potentially making it narrower or trapping debris, which can make the dog more prone to future ear infections. And it can cause chronic discomfort.
So it has long-term health implications too, not just cosmetic. That sounds like something every dog owner would want to avoid.
Absolutely. And that's why our sources explicitly state that at-home remedies or just adopting a wait-and-see approach are really not recommended as primary care. The risk of complications, prolonged discomfort for the dog, and that permanent deformity is just too high. Professional intervention is truly key here to ensure the best possible outcome.
Okay, so to quickly recap for everyone joining us on this deep dive, we've learned that canine ear hematomas are essentially these blood pockets, right? They form within the ear flap, most often caused not by a big whack, but by relentless head shaking or scratching.
Right, self-trauma.
And that self-trauma, in turn, usually points to deeper underlying issues like infections, allergies, or maybe parasites.
Gotta find the why.
Exactly. Recognizing that distinctive swelling, maybe pain, the drooping ear, and then getting a professional diagnosis, that's step one. And for treatment, while needle aspiration is less invasive, it has that high recurrence rate. Surgery is often the gold standard for its high success rate, and importantly, preventing that permanent cauliflower ear.
With supportive care being essential either way.
Right. And the absolute key always is addressing that underlying root cause. Professional veterinary care really is non-negotiable here for your dog's long-term comfort and health.
And that leads perfectly to a final thought for you, the listener, to consider. We often see our dogs as robust and resilient, which they are. But their subtle behaviors, a slight increase in head shaking, maybe a more frequent pawing at an ear, or even just a subtle change in the way they hold their head, these can sometimes be the earliest signals, the earliest clues of a much deeper hidden issue brewing beneath the surface. So the question is, how might paying closer attention to these small, seemingly insignificant cues prevent bigger, more painful problems like a hematoma for our beloved pets down the line? It's really about being observant, being proactive, and truly learning to understand their unspoken language.
What a fantastic point. Your dog is always trying to tell you something. If only we learn to listen more closely or watch more closely. Thank you so much for joining us for this deep dive into canine ear hematomas. We really hope you feel much more informed and empowered now to care for your beloved companions, understanding not just the what, but the why and the how. Until next time, keep digging deeper.